Healthcare. To achieve these aims, Reaching the Unreached runs nutrition outreach programs in neighbouring villages. Babies are regularly weighed to check for malnutrition, and nutritional supplements are distributed. Mother and child healthcare is also implemented through women's groups, who have been trained in basic medical and midwifery skills by RTU. They have built a dispensary which provides free medicine to those in neighbouring villages who are unable to afford medication, as well as to the children in RTU's own villages. In addition, there is a clinic to provide medical care, including immunisations, antenatal care, and dentistry. Serious cases are referred to appropriate specialists. RTU also has a mobile clinic to go to some of the remote villages which do not have access to medical care. Self-help groups. RTU has set up 79 self-help groups in the surrounding villages with the aim of promoting economic development. Saving schemes were introduced where each member saves a small amount every month and pools it into their group. When the total reaches a substantial level, the group starts to give loans to their members. This means that women, such as these, can take loans for income generation activities, for example, to buy a cow for milking. They are also no longer in debt to moneylenders who charge high interest rates, and that means they can invest in a sustainable future. Meetings are held for the self-help groups with Mr. James or other staff members. These meetings give the opportunity to discuss any problems they might be facing. RTU also introduces them to government-subsidised loans and helps them make links with banks. Employment. Reaching the Unreached provides training in basket weaving and garment making, which gives the poorer villagers an opportunity and a skill to earn money for themselves. Home care. RTU provides home care and sponsorship to those affected or infected by HIV/AIDS, but also to others, like Mr. Raja, who is an asthma and TB patient. He has 5 children, and they were living in extreme poverty because he is unable to work. He now gets monthly financial assistance, as well as health care. Housing. Reaching the Unreached also helps people by building low-cost housing. To date, over 7,500 new homes have been built. Mrs. Chinnatai's husband died from alcohol abuse. RTU helped her by building her a house. Francis Xavier's thatched house is typical of many of the poorer village houses, which allow in snakes, rainwater, and are insecure. Francis receives a monthly allowance from RTU and has applied to them for a house. The elderly. Many families in the poorest villages cannot afford to look after and feed the elderly. This woman was forced to live outdoors in her village. In the outreach program, financial aid, clothes and healthcare are provided for the abandoned elderly. A free midday meal is also given. RTU builds houses for the elderly or provides them with a room. Water. Working in what is a drought-ridden area, RTU has sunk over 2,000 wells to provide remote villages with access to safe drinking water. Industry. RTU has batik and handloom centres, initially created to provide work for the large numbers of unemployed in the area. These started with local orders, but now the workshops supply internationally, providing more employment as well as some income for RTU's programme. To supply the materials needed for RTU's housing programme, a cement products unit has been set up, which also provides employment. This makes the breeze blocks, and the doors, and the window frames, as well as tiles. They use local materials and utilize granite dust, not river sand, which can harm the environment. HIV/AIDS. Reaching the Unreached is cooperating with the state government in its efforts to halt the march of HIV/AIDS in the state. To achieve this, RTU runs HIV/AIDS awareness programs in the high school and in villages within a 25-kilometre radius. Here, a senior AIDS doctor from Madurai teaches the mothers from the children's villages how to care for the affected children in case of small injuries or illness. The doctor also gives regular checkups to the HIV-infected children at the children's villages. RTU also provides support and home care for families infected and affected by HIV/AIDS. Sumati and her husband Mr. Murugan are both HIV positive. He finds it difficult to get work, and so they get assistance from RTU for food and other monthly needs. Mrs. Bothmani's husband died of AIDS. She is 35 years old and receives one-to-one counselling from RTU staff. Those with AIDS are treated at the Jivan Jyoti Hospice, run by nuns, with assistance from RTU. The hospice provides nursing from the highly trained nuns and visits from specialist doctors. Medication, provided by the state, is collected from Madurai. This woman lost her husband to AIDS, and so decided to help look after the infected children in the hospice. Because RTU is one of the few organisations who will help HIV/AIDS patients, they take in children as well as adults from a much larger catchment area with this new and growing problem. As you can see, RTU has a wide range of activities, but its overriding priority is the health, education and happiness of the children.